This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, June 30th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. Cameroon is one of the African countries worst hit by the COVID-19 pandemic and is struggling against misinformation and fake news on the virus. Cameroon's digital-first responders are taking to social media to counteract the misinformation. Moki Edwin Kinzeka narrates this report by Anne Nzoka from Yaoundé.
The COVID-19 pandemic has flooded Cameroon's health workers with questions about the virus and about false rumors that hospitals are overwhelmed and that testing is either not available or costly. The director of Cameroon's National Social Insurance Fund Hospital, Dr. Anne Jomland, took to Twitter to counteract the fake news and remind the public that testing is free and where to get it.
I think it's a channel for information. When you have a lot of followers, the effect of the tweet can go a long way. I must say, it helps the community.
The United Nations in May launched Verified, a plan to promote digital-first responders like Dr. Len to fight misinformation on the coronavirus. In Cameroon, ICT Media Strategies created Smart Click Africa and COVID-19.cm to remind the public to check news sources on the virus.
La première question à se poser, c'est de savoir.
The first question to ask is who posts the information. That is to say, is the person posting the information a resource person? This implies that you have to go to his profile to find out if he is a doctor. If the person usually posts verified and verifiable information.
The editor of Cameroon's Mosaics newspaper, Parfait Tabapsi, says the counter-disinformation efforts are helping, especially when experts like Dr. Land are involved.
Le professeur en question est déjà professeur de médecine, ce qui est déjà quelque chose de très important.
That professor is, first of all, a professor of medicine, which is something very important. Then she is responsible for a hospital unit in Cameroon, in Yaoundé. These are the two reasons why you need some information. You have to go see that side.
Dr. Land, who is also the president of the Cameroon Society of Pediatrics, plans to expand her role as a digital-first responder to debunk disinformation on maternal and child health. For Anne Zwanke in Yaoundé, Moki Edwin Kinzeka for VOA News.
Frontline medical workers at a Maryland intensive care unit say the coronavirus pandemic is far from being over. More than 30 U.S. states are reporting infection surges after taking steps to reopen their economies. This comes as COVID-19 cases worldwide surpassed 10 million and more than 500,000 people have died. VOA correspondent Maria Diallo reports.
The Fort Washington Medical Center in the state of Maryland went from 4 ICU beds at the start of the pandemic to 16 ICU units as it quickly became a hotspot for the virus during the early days of the crisis. Kevin Cole, a respiratory therapist at Fort Washington who also has asthma, says he knows the anxiety and fear coronavirus patients experience when they can't breathe. And it's hard for him to understand the sudden return of crowded public places when it's hard to social distance.
I see patients unfortunately dying from this virus every day. Everybody is out lounging on the beaches and just thinking that it's over, and it's not. It's far from being over. Yeah. And unfortunately, it's those people that will keep this pandemic going.
After taking steps to reopen, 31 states are now seeing surges in new coronavirus cases, including new hotspots of Arizona, Texas, and Florida. With more than 8,500 new confirmed cases of COVID-19 and 29 deaths reported on Sunday, Florida Governor Ron DeSantis said that interactions among young people are driving the surge in confirmed cases.
Our median age of new case began in the 60s in March. For most of the pandemic in April and May was in the low 50s. Now, this week, or else the last 10 days probably, it's been between like 33 and 36 for the median age. Half the cases are in their early 30s or below.
Back in Maryland, registered nurse Trakina Hogan says seeing colleagues put on full sets of personal protective equipment required to enter rooms with COVID-positive patients is a constant reminder of how easily the virus can spread.
This is a real thing. It is not fake. It is definitely one that we need to take serious precautions on, keep our masks on, keep our hands washed. We come to work so that we can take care of them, but we need them to take care of themselves and not get relaxed.
A message echoed by her colleagues and medical staff all over the country. Mariama Diallo, VOA News, Washington.
Up to 1.5 million Afghan nomads are facing hunger and hardship due to the extended COVID-19 lockdown in Afghanistan. In the last 3 months, the Kuchi nomadic tribes have been left with little income and a shortage of food. The closure of the main markets left them few places to trade and earn a living. Border closures have also led to a huge increase in some food prices. In the last 3 months, some products like rice and sugar have risen by a third, making it harder for them to afford basic essentials. We get more in this report from the International Fund for Agricultural Development.
When COVID-19 hit Afghanistan, Afghan nomads like the Kuchis had a tough decision to make: get sick or go hungry. To stop the spread of the virus, many Afghan provinces imposed stringent lockdown measures. But for the 1.5 million nomadic Kuchis, it provided a greater danger. The nomads are amongst the poorest and most marginalised groups in the country. They make their living by herding sheep, goats and camels. But the restrictions meant no spring herding and stopped all market trading, which meant the Kuchis had no income and a shortage of food. Continuing to herd and breaking the lockdown meant increasing their chances of being exposed to the virus. And as many of them cannot read or write, access to information about COVID-19 was extremely difficult. When COVID-19 hit back in March, the Community Livestock and Agriculture Project, known locally as CLAP, stepped in to help. Jointly funded by the International Fund for Agricultural Development, or IFAD, and the Afghan government, they trained up local field workers and vets to teach the tribe about protecting themselves from the virus using pictures instead of words. They provided hygiene and health safety kits, including masks and soaps, to 48,000 Kuchi families. Living in remote regions, decades of conflict and drought have destroyed the nomads' grazing areas and increased animal diseases in their herds. Since 2015, the CLAP project has been working with the Kuchi community across 7 provinces, helping to strengthen animal health and improve food security for 50,000 poor households. They have trained up people to carry out basic veterinary procedures on the herds and teaching the Kuchis how to improve their animal feeds. Working with the Kuchis has seen the mortality rate in the livestock cut by half, improving the health and welfare of the tribe. Helping the Kuchi not only benefits the nomads, but the whole of Afghanistan.
نو د دې کلنۍ عاید به د ملک په اقتصاد باندې څونه مثبت تاثیر وځي زمونږ اقتصاد په زراعت او مالداري ولاړ ده نو وخت کې چې مونږ مالداري خکو زمونږ د ملک اقتصاد به کېږي.
Afghanistan has extended its lockdown for a further 3 months, posing a huge threat to the nomads' health and livelihoods. Afghanistan has reopened some markets, but they are too far for many of the nomads to travel to. The project is now helping the tribe shift production from milk to longer-lasting products like ghee, a clarified butter that can be sold when more markets reopen. With a new product to sell, the Kuchis hope they will be more resilient to future crises.
That report was by the International Fund for Agricultural Development, a United Nations agency. The Grand Ethiopian Renaissance Dam continues to be a major source of disagreement among the Nile River countries of Ethiopia, Sudan, and Egypt. VOA Salem Solomon spoke to U.S. Congresswoman Karen Bass of California about a letter the Congressional Black Caucus issued in regards to the dam and what the U.S. appropriate role is in mediating the tensions.
The Congressional Black Caucus, of which you chair, sent a letter that highlighted the importance of the dam in providing electricity to the region. However, Egypt has been critical of the dam, warning that it could reduce its access to fresh water and make agricultural use unusable for the people around there. So do you think there's a resolution to this conflict that will satisfy all three countries?
Well, that's difficult for me to say if there's a resolution. The point of our letter and my perspective is that I think it's important to let the three countries resolve it themselves. I was worried when the U.S. became involved, and I thought that that could just complicate things, considering that we have very different relationships with each country.
That's right. And speaking of the U.S.'s involvement, the U.S. Department of Treasury has been playing a mediation role between the three countries. Do you think the U.S. has played a constructive role, and has it been impartial so far?
Well, I think it depends on the country's perspective you're looking at. I think from the Ethiopian perspective, they were very concerned. But there's a more fundamental problem here, and the fundamental problem is the Trump administration. And the Trump administration's real lack of a strategy and a perspective on the African continent. And so there's not a level of trust and relationship there. And so I don't think it's a good situation to begin with when it comes to the Trump administration trying to broker anything in Africa.
Egypt has also been referencing a colonial era. They've cited that colonial era law many times. This time is an awakening all across the world of revisiting of colonial remnants.
Yes.
And so any thoughts on that?
Yes, I think that the world is going through the same thing, and that I'm proud to say, probably emanated through the protests here in the United States. The death, the torturous, slow murder of George Floyd certainly raised the issue of human rights in the United States. I was very grateful and proud that all 54 African countries went to the United Nations and raised this issue. I thought that was good. And it's caused it's caused people in Europe to look at their roots for slavery and colonialism. And so I think that that's a good thing. In the United States, we're still fighting the Civil War. And the idea that we actually had statues and other things that enshrined people who tried to destroy the country, it makes no sense. And they were dedicated white supremacists. So we've had this soul-searching time in the United States, and I think that other countries are mirroring that. And so looking at colonial laws, I know some countries are looking at even the names of streets and buildings. And I think that's right. I think that's part of evolution and part of moving forward.
That was U.S. Congresswoman Karen Bass speaking to VOA's Salem Solomon. In part 2 of their interview, they discussed the police reform bill that Bass sponsored, named after George Floyd, and what the world and Africa in particular can take away from the movement. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, a South African animated documentary short film illuminates the challenges of living with diabetes. We'll be right back.
People, now you ready to ride?
Hello, I'm Lynn Ormoudou, your VOA Health correspondent. During the COVID-19 pandemic, the World Health Organization says there are currently no drugs licensed for the treatment or prevention of COVID-19, and there is no proof that hydroxychloroquine or any other drug can cure or prevent coronavirus. The misuse of hydroxychloroquine can cause serious side effects, illness, and even lead to death. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. U.S. corporations are responding to a wave of protests over the recent death of George Floyd, a black man who died while in police custody, with pledges to increase diversity, donations to civil rights groups, and in some cases, changes in company policies long sought by critics. VOA's Julie Tabo has the details.
I have resigned as a member of the Reddit board. I have urged them to fill my seat with a black candidate.
Alexis Ohanian is married to tennis star Serena Williams, who is black. But even without that personal connection, many in the corporate world are saying Black lives matter.
I'm saying this as a father who needs to be able to answer his black daughter when she asks, "What did you do?"
Out of the 500 largest U.S. companies, there are just 4 black CEOs, says Fortune, which ranks America's largest companies.
No justice, no peace.
Amid global protests, more corporations are now pledging to put their money where their mouth is. Apple is increasing spending with black-owned suppliers. Facebook CEO Mark Zuckerberg announced in a Facebook post that his company will be donating an additional $10 million to groups working on racial justice. Google CEO Sundar Pichai wrote that the company would give $12 million to organizations working to address racial inequalities. YouTube said it will use $100 million to fund black content creators. And Bank of America pledged $1 billion over 4 years to address inequality.
When you see people taking to the streets like they did, you know something is happening, that this is the beginning of a movement. It's not business as usual. And I think businesses are realizing that, wait a minute, something different's happening here. And we can't just continue to do things the way we did before. That, after all, is what protests and unrest are all about. It's about forcing people who won't do it otherwise to change.
And it's not just about the money, but policies also. Walmart used to lock multicultural beauty products away in stores. That stopped after critics said it suggested customers of those products are more likely to shoplift. In early June, Amazon announced that it will donate $10 million to organizations supporting justice and equity. The world's largest online retailer has also frozen police use of its facial recognition technology, which critics have said is more likely to misidentify people with dark skin. And NASCAR, prompted by its only black driver, has banned the Confederate flag, a symbol of white segregationists, at its racetracks and events. It's been unusual in the past for big brands to embrace activism for fear of alienating customers. Now it seems many see it as a greater risk to not take a stand.
Don't shoot!
Julie Tabo, VOA News.
The World Health Organization says the prevalence of diabetes has been steadily increasing over the past few decades. About 422 million people worldwide have diabetes. According to the International Diabetes Federation, 19 million adults in Africa live with diabetes, and 60% of adults with the disease do not know they have it. A South African animated documentary short film, 3 Teaspoons of Sugar, aims to shed a light on the complications of the disease. Africa 54 health correspondent Lino Mudu spoke to the co-directors, Dr. Shepo Maaka and Kabelo Maaka, a mother and a daughter who combined their skills in medicine and animation to produce the educational film.
Dr. Shepo Maaka and Kabelo Maaka, thank you so much for joining us today.
Thank you. Thank you for having us.
So you are a team of mother and daughter, and together you have created a documentary called 3 Teaspoons of Sugar. What prompted you to get to the documentary? What's the background story to this? And I'm going to start with the mother, Dr. Shepo.
Look, I had no intentions of ever being in animation at all, but I realized that it is a good tool to simplify complex medical things. I trained in anesthesiology, and so when I first had my challenge in explaining what an anesthetist does, I realized that animation could actually help me. And when she did that, I then said, okay, let us collaborate and work together and create medical animation and content. That was the first thing.
Do you remember when you were first diagnosed with diabetes?
It was in 1989 when I lost my first baby. I was diagnosed with sugar diabetes. It was pregnancy-induced, in fact.
Kabelo, why did you get drawn into this project?
So I have always loved animation. As I have kind of been doing animation in South Africa, I decided, you know what, let me just start my own company called Cablo Studios. And Dr. T, who's my mom, came in and partnered with me. And then that's how I realized, okay, we can create animation in the medical space. And then specifically for this film, it was kind of a natural thing to tell the story with our family, because the animation also features the actual voices of our family members.
So it's really drawing from personal experience. And Dr. T, as you like to be called, talk to us about the issue of diabetes. We know that it is a growing problem in developing countries, and Africa is seeing its share of the burden.
In South Africa right now, we're sitting with just under 5 million cases of adults with diabetes. So it is quite costly in terms of the burden on families, on the quality of life for those that have diabetes, but more importantly, on the health systems. So it's something that we cannot ignore. It's something that we cannot just sweep under the rug. It is one of the, and currently now, people that have diabetes are at high risk of getting complicated COVID-19 and even dying from it.
Kabelo, can you talk to us about creating animation around this story? Usually when we think about animation, a lot of time people think that it's for children. So how much impact do you hope to create using animation to raise awareness about a problem that is affecting many, many adults?
What I think is really lovely about animation is that it can make medical content charming and actually less intimidating to engage with. So with our animation, we're really hoping to make the information easy to digest and easy to remember, and also make it personal.
And what I like, just to add on that, is that health literacy is very low. Animation allows us to talk to people at all health literacy levels, and also because you can dub it in different languages.
Yeah.
What do viewers take away after they watch this short film?
So a lot of people have said, they've connected with the story because their families have gone through similar things. Others have said, oh, you guys made it so easy to understand and see the symptoms because you explained them so simply with the drawings. So my intention was just to try to share a family story and try to be as clear as possible.
So Dr. T, how do they make sure they don't get it? And if they get it, they don't get the complication?
We have a history of diabetes in our family. So for us, exercise is on top of the list. Secondly, it is eat small portions, make sure that you have a balanced diet, more fruits, more vegetables, avoid processed foods, avoid fizzy drinks, drink a lot of water. Obesity is a risk to developing diabetes. So you have to make sure that your weight is contained, and if you have a diabetes, ensure that you get checked by your physician to make sure that your eyesight is okay. They check your heart, they will check your kidneys every now and then, and your sugar level, and make sure that you're compliant with your medication.
So Dr. Chepo Maaka and Kabelo Maaka, thank you so much for joining us today.
Thank you for having us. Thank you.
The animated documentary 3 Teaspoons of Sugar focuses on 3 individuals who share their experiences living with diabetes. The educational film is screening online as part of the NSA International Animated Film Festival and also available on Vimeo on demand. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.